Let's get more now on the claim by mental health providers in England that they've seen no significant extra investment in children's psychiatric services. That's despite government plans to improve the system. Last summer, ministers said they'd invest an additional £143 million in services this year. But health trusts say cuts are still being made and have called on the Health Secretary to publish how many clinicians have been hired. With me now is junior doctor Rory Conn, who's specialising in child and adolescent psychiatry. Dr. Conn, thank you very much for taking the time to talk to us. So, you're on the front line. Are you seeing any extra money coming into the system?
Well, the first thing to say is this is a really key time for child and adolescent psychiatry. We've been desperate in child and adolescent mental health for a number of years. I was going to offer the context that prior to this money even being announced, there were £35 million of cuts across child and adolescent mental health. And since 2010, 20% of local authorities have frozen or reduced their budgets for child and adolescent mental health. So the announcement last year was really met across the board with positivity, and we were delighted to hear that. As yet, certainly on a local or regional level, I, as a junior doctor, haven't seen particular changes.
So huge disappointment then. What is it like to be with families of children and young people who are desperately in need of services that you just can't offer them?
It's terrible. It's desperate for them, and it makes working conditions for us in a particular specialty much harder as well. I'll give you a particular example, something that's been happening quite a lot in the last year to do with a lack of beds to admit these young people to. I should say that the majority of child and adolescent mental health is delivered in the community, and young people don't need to be admitted to specialist wards. But as per earlier in your show, and a mother was talking about the difficulty in accessing beds, sometimes there'll be waits of days to weeks for young people to be admitted to the specialist care they require. And it's desperate. Equally, I've been involved in shifts on the front line, working at weekends and in the middle of the night, looking after young people in London, where the nearest beds have been hundreds of miles away. So in December was the recent time that happened to me. 2 beds were offered, one was in Southampton and the other was in Sheffield. And to think about young people in distress and their families in distress as well, having the prospect of being shipped across the country for a problem for which they very much need to be treated locally is really quite shocking.
So in those cases, did the young people have to go many, many miles to get those beds?
Yes, and that can make the problem worse, of course, because they're away from the community which they need to be a part of, from their schooling and from their families as well.
And you also mentioned, just as we were chatting briefly beforehand, that in some cases young people are being sent to police cells because there's nowhere else for them to safely stay.
So yeah, there's huge inequality across the country about what services are available, and there are several counties still in the UK which have insufficient provision for an under 16-year-old who's in a degree of distress that requires them to be brought to a place of safety by a police officer. And in some of those counties, those young people have no option because there is no A&E that will accept them and no appropriate immediate mental health provision. They will be taken to police cells. That's been in the news before, and
that can't help anyone, can it?
Yeah.
Obviously, you're not involved in commissioning, but when you hear these concerns that perhaps some of this money has been siphoned off to help out in other areas, how does that make you feel? I mean, on one hand, I guess you understand that there are huge pressures on other parts of the health service as well, but this is the area that you're specialising in.
That's right. I mean, we work in very broad systems, particularly in psychiatry. You have to think about adults as well as children. But to understand that this money hasn't been ring-fenced, and I believe it should be ring-fenced, it's quite difficult to hear that, because it may well be that the prospective improvements that we've been looking forward to for a long time, and indeed telling our patients and families are on their way, will not arrive.
OK, Dr. Rory Conn, thank you very much for sharing your experiences with us.
Thank you.